that spinal extension. But it's really, the movement is the spinal extension that I'm getting. Okay? So that's very important to know what your points of control are. So you need to know at what point you want that distal point of control, what point you want the actual proximal point of control. Okay? So when would I use a proximal point of control? When I'm taking someone and doing a standing balance task. If I feel like the trunk is falling forward, I'm going to go up there. But if I feel like the pelvis is not steady and I need to stabilize the pelvis, I might go just right there. Okay, I may go right here to help with the co-contraction between the abs and the extensors. Okay, so as you're working with the client, you're going to determine where your hands need to be and what you need to be doing. Okay, there is no one rule that explains where your hands need to go. Okay, so with the upper extremity, this is a proximal, this could be a proximal control, this could be more of a distal control, where I do this to get extension, I do this to get flexion, okay? And so when we do the upper extremity, I'll show you how to facilitate flexion, extension, and all of that. But for today, if you're in acute care and someone has already started developing tone, what is happening to that upper extremity? Which muscles are in a contracted state? Let's say this is the position, this is frequently the position they're in.
Biceps.
The biceps are tight.
Wrist flexors.
Pec major.
Pecs, okay, are all tight. Now, you want to straighten all of that. Something else that we really don't talk about, but is also spastic, is the one more structure that you haven't mentioned. The interosseous membrane. Okay, so the interosseous membrane between the radius and the ulna is also tight and spastic. So invariably, when you're asking someone to move and what they're doing is if this is tight and it's not allowing the person to go into supination and pronation and all of that, and they're trying to move, then what are they going to do? They're moving their elbow in order to get to something, okay? Because they don't have this movement to reach, okay? So I'm going to ask, so before we go to the upper extremity, we also need to talk about the lower extremity. So the lower extremity can go like this, or it can go out like, so inversion, it could go into eversion, right? So let's start off with the inversion. So with the inversion, tell me about what you know. For now, you can just relax now that we've shown us this thing. What do you know about, what happens to the ankle joint? Tell me more about the, I want to get an understanding of what you know about the ankle joint. Which are the bones that make up the ankle joint? Talus.
Cuboid.
Tibia and fibula. Yeah, the cuboid is further. Right. Okay, tibia and fibula. So now when she's like this, what is happening to the talus? It's coming out of that joint, right? The talus is what kind of articulates within the little socket that the tibia and fibula create. But now when the leg goes out like this, the talus slips out, okay? Now, if they want to get back, they do not have that muscle coordination to get back. So once they've gone into that abnormal movement, that's where they stay. But when you're working with them, you want to make sure that talus is back in place, okay? So now I'm going to show you how to get that talus back in place. You put your hand right on the talus, you push the forefoot, pull it forward, get a little distraction, and get it back into place, and place it there on the floor, okay? So once you do that, you can then go to the upper extremity. But also I want you to remember, once you do that, you just work on the upper extremity. Are you done? No, you got to make sure those muscles are working in a coordinated way. So let's say we've got the talus back in place. We're going to work on the upper extremity. We're going to stretch it. What are some functional tasks could you engage the client in order to help with that coordination, that lower extremity, so that talus doesn't slip out? Think, getting from sit to stand, doing squats, all of that works, the tibialis anterior, the gastrocs, because you want all of those muscles working in coordination, okay? So when you're working on squats, someone may go, oh no, that's a PT exercise. But we OTs need it for lower body dressing. We need it to get things off the floor. So you know what your functional goal is, but you also need to take care of the base of support, because unless they have a base of support, you can't engage them in ADLs. So you have, that's definitely within your sphere of practice to do all those exercises, okay? So let's say we're going to do this again. So again, here's a talus, see where my thumb is, see where my fingers are. You're going to resist me a little bit, okay? So I'm trying to get this out. So I'm trying to cause a little bit of traction, get the forefoot out, get the talus back in place, and then place it, okay? Now, if it's a male or someone who's big, what do I want to say, has large bones, and you're not able to just use one hand, you may need to use both your hands to help that client. So you notice with one hand one of my hands was right here helping the knee, the other was helping the foot. So if you need to use both your hands, then what happens? How do you support that knee?
Your chin.
Your chin or your forehead, okay? Something else that you need to do, once you've got that foot back in position, you want to stretch that leg in that direction, because all this time it's been in this position. This is the shortened state. And the navicular is a tarsal that is sort of the cornerstone of that arch there. And you want to push it back in place. So you position that leg there and give it that stretch inwards. Okay? Once you've done that, the next thing, the natural thing to do is to go into squats and all of that. Okay, but for today, I just want you to know these are the foot moves that you do with the lower extremity. Now, when we go to the upper extremity, I want you to go into that flex posture, okay? So, watch my hand. I'm going right at the back of the elbow to facilitate this movement, okay? Why do I go to the back of the elbow? Right, I'm going to the head of the radius, okay? So, why do I choose the head of the radius rather than just straightening it out? Right? The biceps tendon inserts into the head of the radius. So by just pushing the head of the radius out, I'm stretching the biceps without putting my hands on the biceps or without trying to go out like that. So once I've got there, here's someone else with a little bit of hyperextension. You don't want to aggravate that hyperextension, okay? So just always make sure they have those soft elbows, soft knees, okay? So once I've done that, her hand is still in this position. I could either go here and do this, or I could come down here and straighten that wrist, okay? So to straighten the wrist, you want your thumbs right on the wrist, pointing in the direction of the axis of the radius and ulna. I want to say radius and tibia. The radius and the ulna. Okay, so you put your hand there. These fingers are right there with on the pisiform and the triquetrum, okay? Your thumbs are right back here on the MCPs, and I'm pushing in that direction. And you can just go there. Why do I do that? I could just go ahead and straighten it out, right? Why would I go ahead and mobilize the wrist in that direction or in that way?
Facilitating those muscles?
Yeah, facilitating the muscles, but remember there are 2 rows of carpal bones. And when this happens, those carpal bones rotate on each other. So if you're just going to try to straighten it out, you could cause injury, you could jam those bones, So here, this way, you are actually derotating those carpal bones. Okay? Once you derotate those carpal bones, you want to spread the MCPs. Okay? The hands are still clenched. So you do your little rhythmic rotations, okay? Is that a PNF pattern? The answer is yes, okay? So it's a PNF. So you see, I'm using all these techniques, and they're not necessarily one particular technique like that. It's not all just NDT. We borrow from different disciplines or different techniques in order to get the job done, okay? So, again, I'm going to go again there. So slow movements, circular movements. And so once I've got this, you place that hand again. I want a little bit of that elbow bend, okay? Now I'm going to do the interosseous stretch. For the interosseous stretch, I'm going to get a hold of the radius and the ulna and stretch, okay? I'm using my thenar eminence, I'm using my fingers. Get a firm grip, stretch. Okay? Once you've done that, you can get this medial stretch, okay? So my hands are, I'm stretching to a point where I'm almost getting into this little trembling this thing, but you don't want to just stretch and stop. You want to give them a good stretch, okay? You go medial, and then you go distal. So the direction of the stretch is to the center and up, okay? So medial and up. Okay? Once we finish with that, I'm going to go in this direction. Again, that's just to stretch the radius from the ulna to get that interosseous membrane. Okay, once we've done all of that, I'm going to take this hand and so the client may be actually able to do this at this point. You just support the fingers out in extension. You can ask the client to just pull that hand and place it right there. Okay? But now that you've done all the stretching, you've got to actually take them through some kind of a function to help them work those muscles in a coordinated way. So, just because of a lack of body parts to kind of hold things down and all that, you can actually, so what I would do, and I have done it, you can actually use your leg not to put all your weight on the client, but to just stabilize that hand. So then you've got your other hand, and you've got your leg here to support the client, okay? So I could put my foot on that client's foot because I do not want it to slip. And I will ask the client, I'll ask, I want to call you Brittany, to touch her toes, okay? She's going to go touch her toes. Now push with your right arm and come on up. Push with your right arm and come on up. And go reach out, So you see you can incorporate a PNF pattern right there. Okay? So this will help them. This is going to work on their trunk control, works on reaching for things off the floor, balance and all of that. But it also works on, when her mind is out of focus on a goal, she's working on using the upper extremity movements like elbow flexors, the biceps and the triceps. Something else that she's doing when she's here, when she goes to the, can you point out in that direction? What other muscle are we stretching here? The pecs, okay? Plus we're getting all of that rotational movement in her trunk. So, points of control are NDT, handling is NDT, but we're also using PNF, and we're also using roots, or I feel like something's not working, I could even tap that muscle when she's going down. I feel like I'm not getting a good enough biceps contraction, I could tap that muscle and have her go down, okay? But what I'm doing here with my hand is approximation of the shoulder, because what happens is, and we'll talk about this in the next lecture, once you've had a stroke, that weight shifting onto that affected side is very difficult for them. So I'm giving her that approximation, that proprioceptive input on this side. I'm using my elbow right there to support her elbow so that she doesn't go out into internal rotation, okay? And I'm having her go down and come back. Okay? Now, I feel like she's going a little way off her base of support, her center, and it may be because I'm facilitating too much. So you got to pay attention and get her back into alignment, okay? Because everything that you do is going to impact the client. So not only use your hands and stretching and all of that, but also observe and see what the client's posture is like, what she's doing, so you can take her through these movements. Okay? Any questions? All right, good.